Very good afternoon to your calling. And yes, as just mentioned, Dr. Zweli Mkhize, Health Minister, has just arrived at the Charlotte Maxeke Hospital to assess the situation here. And of course, his first visit since that fire broke out on Friday. And we understand that it actually started from the basement of this hospital, collapsing the third floor at this particular hospital. But we just want to get more details in terms of the update, especially regarding some of the patients that had to be removed. In fact, we understand that it's 794. If I remember very well, Kwara Kekana talking to me earlier on. She's here now with me. Kwara, just give us some update, please. What's going on with those patients? Have you been in contact with them in those hospitals?
A very good afternoon to you and good afternoon to the viewers at home. You're correct on the figure that we spoke about earlier on. We were able to evacuate 794 patients by evening of Saturday, and we actually had a total of about 819, give or take, patients that were admitted at Charlotte Maxeke at Johannesburg Academic Hospital. Of that figure, we discharged 25. So these were patients where clinicians made an assessment of whether or not they're in a condition where they could be discharged to go home, and we proceeded to do that. This is also part of just trying to alleviate pressure and just ensure that we take as less patients as possible. But of course, it's a bit of a low number. So we then transferred those patients to various facilities across the province in Gauteng. Nelson Mandela Children's Hospital was one of those facilities, and thankfully it's quite close by. The neonatal ward kind of shifted to that area as well, so which was quite key. Some services have shifted to Chris Hanipara, Steve Biko Academic Hospital, Sterkfontein for mental health care users as well, Tara Hospital, Edenvale. So really they're spread out across all the facilities in the province. The engagements with loved ones of the patients is ongoing. That process started on Saturday through our provincial hotline team that has been also making calls to loved ones, but also receiving calls from loved ones. One of the things now that we're starting to manage, and as I had a conversation with you earlier, is just about updating people with regards to where do they get services that they had previously were getting from Charlotte Maxeke. So the hotline is also dealing with some of those things. But of course, the issues we communicated earlier on in the morning around gynae surgery and gynae clinics, that service is shifted to South Rand Hospital. And of course, the hospital has made a commitment that they will be engaging people directly with regards to making appointments as well. The planned C-sections as well would be, the coordination will be starting from the Discoverer CHC in the west of Johannesburg there. So those are some of the developments. But of course, we are shifting services, and as and when we have really, concretized some of those details with other facilities, we will be communicating to the public as to where they can go for other services.
I know that investigations are still underway to determine the cause of that fire. How far are those investigations at this stage?
So on Saturday late afternoon, the team from the South African Police Service is already on site with regards to commencing with the investigation. The team from the Department of Infrastructure and Development were also on site, the engineers there. I think this speaks to issues around assessing the structural impact of the fire from that angle as well. But I'm not privy to how far they are in terms of the investigation, assessing what extent of the damage is there. The MEC for Infrastructure and Development is here today, and I think you guys will be able to engage with her, MEC Motara. She will be able to take you into confidence as what are some of the preliminary findings from her team as well. So perhaps we can give her that opportunity and her team as well. But at this stage, I'm not sure what the preliminary assessments are saying.
A private company that also assisted firefighters to battle the blaze, saying that it looks like there was a shortage, or there's a lack of working fire hydrants here at the Charlotte Maxeke Hospital. What do you know so far?
So two things that we've received in terms of reports from the Department of Infrastructure, through the annual inspections that they do. I think they indicated to us that they do about 2 inspections per year, and that took place here at Charlotte Maxeke. And when they did the last inspection around November, towards the end of the year, they found no issues with regards to the fire hydrant. Second to that, the City of Johannesburg engine, which was the first one on scene, as they've explained to us, some of the challenges with regards to establishing water connection was the issue of caplings, what they call caplings in their own fire language. They were not able to establish connection through that point, but they were able to then establish water connection through another fire hydrant in the vicinity, and in addition also shuttling water in order to battle the blaze.
Health Minister Dr. Zweli Mkhize has just arrived, as I indicated earlier on. What are we expecting? And I understand that due to the limited space inside the media personnel not allowed in there. Just take us through the process. What's going to happen behind those closed doors?
I do think that, Dr. Zweli Mkhize today, one of the things would be to get an update from the hospital team, the EXCO, particularly from the clinical side. I mean, we're engaging earlier on just in terms of from a clinical point of view, in the management of patients' point of view. So the heads of the departments are there from a clinical point of view, just giving an update as to where we are, just in terms of the patients. But of course, other critical services where we need to tighten up those details and indicate to the public as to where would they be receiving those services. One of the most important elements would be oncology, the oncology department. We're finalizing those details, and we would be able to take the people of Gauteng into confidence as where do they then proceed to in terms of that particular services. So those kind of elements would be discussed today. But I guess also because the MEC for Health is here, the MEC for DID is present as well. So perhaps also just to take the minister into confidence as to where we are with regards to the hospital. I know, the anxiety for everyone in Gauteng is just, appreciating what Charlotte Maxeke Hospital is for Gauteng, for South Africa, and the continent at large. It's quite instrumental, but also in the fight against COVID-19. It's quite integral to the response against COVID in the province. So those are some of the conversations I would imagine. But of course, I think they would address the media after the engagements upstairs.
Thanks so much. Kwara Kekana, the spokesperson for Gauteng Health Department, and she will soon be joining the minister in that room where they are at this stage. But we'll bring you more details once the briefing ends in there, so that we know what's the way forward. And I'm sure the questions will be, when exactly will this hospital reopen? Because when we arrived here, we saw some of the security staffers returning back some of the patients to tell them that this hospital has been temporarily closed. And of course, we will give you more details later on in terms of all those assessment processes that are taking place currently.
Okay, Maggeketla, we'll speak to you later. Maggeketla Mohlabe is coming to us live outside the Charlotte Maxeke Hospital.